Now, Tan Sri just had the stem cells yesterday, okay? And how is your response? How do you feel? Everything after the stem cell, any reaction or things like that?
The reaction is very good. When I was at the time, my muscle becomes frozen, my two legs frozen, and now I feel that I'm okay, but because of my age, maybe we can slow a little bit. So that is the first. What I feel that I got the back my movement properly.
And Tan Sri, when you've had your Parkinson, you have been to around the world, and you try a few times the stem cells of other countries, and also in Malaysia, right?
Yeah, right.
Yeah.
I've been to Korea and India to take formula of this stem cells treatment, but it seems that there's no progress at all. So I changed with the introduction of Dr. Mike from my wife yesterday. You can hear from her during the speech here. We're going to talk Puan Sri Nisa with Dr. Mike, and I know this European Wellness Center in KK, which I was born here. I was born in Putatan, raised up in Kampulikas. Here is my playing ground for catching wild pigeon with, they call it lipstick.
Okay.
Yeah.
Now, Tan Sri, from the beginning when you have the stem cell with us, do you see the improvement?
The first improvement that I received 2 weeks after my first treatment from Dr. Mike's, Dr. Dimitris, I think him. My frozen leg at that time, my hand shivering, right hand, and my speech becomes slur. I cannot talk. I lost my confidence at all. I cannot meet people around me. Even my former officers was I'm staring at people, and I cannot laugh. I cannot make my speech understood by people from around me. So when I received the second week, I feel that I get my confidence of talking to people, and I give lectures to Intan, the government officers in the college here in Tuaran. So the same goes to University Kebangsaan Malaysia. I gain my confidence again after the treatment. Now I'm giving talk to college and my college, police college, for my experience as a police officer during the time of reformasi in 1998, during the time where I was hit by a wooden stick from my neck. That is maybe the cause of my Parkinson. The treatment also give me all the confidence level of giving, walking around and talk to my men again. That is the best thing that I received. My mouth and my mind is not synchronized. I feel that I got something to say, but my mouth cannot talk, cannot say the thing. So that is the thing that I improve a lot until now. For three years already. So my second treatment is this one yesterday. Yesterday another procedure I follow through, and my walking condition, my frozen feet come back without any pain anymore. I can walk easily throughout now I also can drive. I can drive my vehicles, a small vehicle, because my focus is sometimes blur. There's a lot of hidden alignment that I have to see. So that's why I'm very difficult to walk and drive. Now it's really improved. I drive from my house in Kinabalu right up here.
You came here today driving?
I came here with
Wow,
driving.
it's very far.
Yeah.
It's 20 over km. Yeah. With the traffic jam some more.
Yes.
You know. Tan Sri, do you like what you see here? And do you think this is one of the best centers to be treating you for your Parkinson?
I didn't realize that I got one big, beautiful center of treatment that I received. When I went to other countries, I didn't see as such. But the doctor is the best doctor that I encounter, and they are very friendly, just like I was treated as like a king to any procedure that they give you. They will always tell you what to do next, and it's precise in that. Whereas in our overseas, you have to wait for some time before you attend by any people during the treatment. During my treatment, they give me a lot of encouragement to make sure that I'm comfortable, and then I feel that the treatment is much better than any place that I went before. Because it is a very big, at that time, the small one, at the other side of the road, the old one.
Yeah,
This
our
one is
old
very
center
big.
was a smaller building, you know. We still have the old center next door, but this is a big one.
Yeah.
So do you like what you have here? You think there is really... I remember when I met Tan Sri by the wife here in a coffee house in Paprika, you know, KL. Tan Sri, 2 hands cannot hold a cup.
Yes.
2 hands cannot hold that cup, you know. And he was speaking to me. I honestly don't understand what he's saying because it's so difficult for him to speak at that time, you know. So imagine he's driving a car and playing pickleball, you know.
Yeah.
Of late, I'm so happy to hear that. I didn't realize you're driving a car because all the time you have the driver will pick you up here, you know. Yeah.
Yeah.
So I'm happy to do that. I'm happy to see that. Tan Sri, what is your word of advice to the rest of the people with Parkinson around us? There's so many people with Parkinson today.
Don't be ashamed of yourself, because you will suffer if you don't do something about it. You feel that it is end of the world. It will not be. You see. I'm 71 years old. 10 years already, I retired from the police force. I gained my confidence in anything I do. I can do small work or big one, giving a lectures to junior police officers for my experience. I have the capacity as giving talk to the university student in University of Kebangsaan. So apart from that, local college, I am very happy to receive such treatment, which I personally experienced is good for myself.
I'm so happy to hold this. Bearing in mind, Tan Sri is the longest Malaysian CID chief. He's involved in interrogation all the time with all types of hard people. You know, a tough man, and are we bringing back your life?
Yeah.
Good. So do you have any question here on the crowd to ask us? Anyone? Yes, please. Okay, when I see Tan Sri, of course, Tan Sri at that time, 3 years ago, he's younger, and of course, but he's still 68, you know, so of course, when you are 68, the whole body we look at is, all of us is aging. I always say that, okay? So apart from targeting the brain, okay, of course we have to target the brain. We gave him the whole brain, you know, also with his movements, okay? And of course, the most important brain cells is always the substantia nigra, okay? That is the part which is producing the dopamine. That is the main reason why you have Parkinson. So there was a depletion. So we have to refurnish back the substantia nigra. Okay, but again, remember I'm saying as we age, you know, every day, you know, you're losing brain cells after 40, 10,000 a day. But what about the other cells of other organs? They're all going down. So when you treat a person, it's not just treating the Parkinson. We also have to take care of his whole body. You know, we also have to look into other organs. So we target every organ, and that's how we treat a Parkinson patient. But it's the same with a diabetic patient. It's the same with other things. So that is how we handle the thing. So like I say, you can't just give one cells. You may have to give even 20 different types of organ cells. So we have to target every organ, and it's important. Of course, we follow with Tan Sri lab work, or we call it the blood test here in Malaysia. We follow his blood test consistently, so that we also need to know, would it be moving into some other scenario, or poor kidney function, or liver, or others, you know, or diabetic. You know, all these are common scenario we have to take care of. But Tan Sri has been adapting very well, I would say that. He do his part. He's still very active in the limelight, you know. He's always in the event, and the wife is, you know, she's so active. Wan Sri, you know, a celebrity chef, and she always bring Tan Sri along. I noticed in the Instagram, you know. And Tan Sri managed to cope along. It's wonderful, you know. And I think there are solutions for all the Parkinson patients or all the Alzheimer's. As part of dementia, we all have to understand, after 65, 1 out of 4 could be moving into dementia. And after 75 is 1 out of 3. And after 85 is 40% risk of getting dementia. So it affects all of us here, sitting down here. Okay, what about our parents, our grandparents, and ourselves too? Okay, now coming back to Parkinson, in the Malaysian experience, I come to realize any place with oil fields, they have more Parkinson patients. Okay, so in East Malaysia, certain area with oil fields, and one of my youngest Parkinson patient is 41 years old. He's still an executive, he's highly paid, but he has Parkinson, and he's not the only one. I have a few who are in the oil fields, who are in the 40s. So there was a lot of, you know, oil fields means there's a lot of heavy metals around the environment. Okay, so sometimes it also depends on our lifestyle and also our environment. Again, it can be genetic to a certain extent. If a family has a risk of Alzheimer's and Parkinson, then it can move on, just like we have with autistic, you know. So are there solutions to be preventive? Yes. I will always say, even if the two parents are short, it doesn't mean the kid had to be short. There are ways to increase the length and the height, you know. So I sincerely believe there are solutions. If we can treat Parkinson, Alzheimer's, or autistic, or Down syndrome, we obviously can treat most part of the other organ, because the brain is the most complex part to treat. Okay, imagine you have 52 lobes with 67 different types of brain cells. So we really analyze the neurologist report of Tan Sri here in the early days. We analyze which part, and we do our observation, we ask our questions. Everything is important, and we are monitoring him all the time. It's not a one-time affair, you treat you and then you're gone. No. Every now and then he's back, we are in contact, and he will always text me, and I always text him too. You have a problem, you have to take care, okay? And things like this, okay? So it's a wonderful experience to treat Tan Sri, because I never expect, you know, a guy I look highly upon in the media, and one day he was my patient, okay? He is my patient, our patient, our client, all right? So any other questions on Parkinson? Yes.
So Parkinson's is not really just head trauma. Sometimes head trauma, mostly head trauma, no? Like boxing, like people with boxing.
Yes, I wrote a book on concussion. Just finished a book with concussion with Jerry Maguire, the real Jerry Maguire. Jerry Maguire was acted by Tom Cruise, and they won some Oscar. But the real Jerry Maguire was Lee Steinberg, and I met him a few months ago, and we both finished a book, and that's where we are treating a lot of, we are moving into NFL, you know, because concussion means the brain knockout may not be at that instant, it can be in the latest years. So you know at boxing, you know, boxing like Muhammad Ali, the reason is because he has been, I mean, each time you have a knock, it may not be at that instant, but it will move on. The knock is accumulative. It's cumulative.
What are the early signs of Parkinson's? I mean, I have well, you know, Manny Pacquiao, my Filipino boxer.
Yes.
I know him personally, but sometimes when I talk to him, he suddenly has, I don't know if it's brain fog or he is not listening, or I don't know.
There is some early symptoms. There are some early
jumps
symptoms of
already.
Parkinson, you know,
Because
but
of
of course
boxing.
with the tremor, it become more frequent, then you have to be more observant, you know. And,
I should bring him here.
Yes. I
Even-
was
even
with
stress.
Manny a few years ago in Bangkok, you know, when he was going to fight Bakau, you know, the Thai champion, and those were the time I met him and the wife, you know. I believe if I have a chance, I always love to treat, we always love to treat the brain, our team. The neuro part is always our favorite, you know, and it can be regenerated, okay? So everything can be regenerated, like I say, as long as they are still living tissues in any organ, even if they're dying. But if they're dead tissues, scar tissue we call it, there's nothing you can do because it's gone. If everything is gone, what can you do? There's nothing you can do, all right? So there's solution. You regenerate by stimulating, by regenerating, but again, there's a depletion. You also have to add on. That means you top up, okay? You are topping a leaking bottle at the bottom. If the holes get more bigger, then you have to come on with more topping up as soon, and you have to do some repair, all right? So, like I say, we can't stop Parkinson totally. In medical world, there's nothing for Parkinson or Alzheimer's.
To reverse back.
Yes, but we can do some reversal if we can. And the important part is delay the progression. If you don't delay the progression, it will come fast, kill it down again, okay? At the end of the day, the drugs will not work because after some time, the body will not accept it. So in other words, the patient will go down fast. So our side is, number one, do some reversal as much as we can and continue to delay and delay and delay. We are playing a delaying game. So if I can delay, we can delay it for 20 years or 30 years. Lay it forward. It's a wonderful thing. Life is delaying. In all diseases, in the field of anti-aging, we are delaying. We are not meant to live to 120, but everyone's saying is you can live to 120. And I'm saying we can live to 120 still. But we must do the replenishment of the stem cells of the targeted organs, and we have to continue to do that. Of course, in our field, you know, and I sincerely think that after the stem cells, you have to do some maintenance with the peptides. Because the peptides are affordable, we do not want the client to keep coming to us all the time. Okay? We also want to delay the time of us to come to us. Okay? But Parkinson, I would say, is good, a yearly affair. We have to monitor, just like a chronic diabetic patient. We have to monitor. Okay? Certain things we may not need to monitor that closely, but in the case of the brain, we have to go it very closely. All right? And that's why we have a relationship with Sri all the time when he's down in Sabah here. Okay. Any other questions?
So just to clarify, you're saying that if you're topping up, once
Yes,
you've done
yes.
the reversal, that's about once or twice a year with stem cells, or the peptides will be sufficient?
Now, it depends on the scenario, okay? If we realize the condition is not to our level, always remember, if you give the stem cell, it's always better. Okay? The stem cells has everything. The microorganelles, the mitochondria, the nucleus, everything, the exosomes, everything is there. It's better than just to give something where this is a complete car with full spec and the other one is only the parts. So if someone can afford it, why not? But not everyone can afford treatments of 2 times or 3 times a year in the case of Alzheimer's or Parkinson. Then we have to think of solution for them too, okay? So again, it's a dosage. When we first give the first dosage, sometimes we may not give such a strong dosage. We have to observe that. We have to look into a weight of a person. We have to look into a lot of angles, okay? So So we normally will not give the stronger dosage, but when the patient reacts, with improvement, that's where we start to increase the dosage, okay? So when you increase the dosage, through our experience, we find it works wonderfully well. But in the case of autistic children, it's different. They are young, they cannot take too much at one go. For adult, yes, we can take a lot. I would say in our experience, we've been giving 20 over different types of organ cells for adults of different disease. They all work wonderfully well. So in the case of Tan Sri, he can say, one day Tan Sri will say, Mike, my vision is not good. Mike, I have a certain problem. Anything can happen. So this is where we had to add on. Something unexpected is coming. Okay? So we have to take care of every part of the body and not just one part. All right? Yeah, because all the organs in your body are deteriorating. None of them is improving. So the improvements means you have to add on something to improve, and then you start to deteriorate. We have to continue topping. Yes, I can only say we can't stop aging. We can do some reversal biologically by 6 to 18 years now. I used to say 16, and then keep on delaying the progress. Okay? There's nothing you can be forever young, impossible. The cells are programmed to die. And if the cells don't die after some time, they become senescent cells and zombie cells, and they will turn into cancerous cells. Okay? So you do need to do some topping. There's no other way about it. Okay? Yeah. Any other questions?
I got
Yes.
I got this prostate cancer.
Yes.
I made a treatment. Now I'm okay. I'm okay. I'm still.
And Tan Sri prostate cancer was initially detected by us.
Yeah.
When we came here for the treatment, and then we found out, we prescribed certain things for him, like the testes, and then we removed the testes and the placenta because we find it would not be good for him. We do not want to aggravate the prostate condition. Through our observations, we found this out, and we informed Tan Sri about this.
Yeah. Before that, I have to do the prostate operation first, then I come back here. And it's a lot of improvement. I always go back to the KPJ. He said, this prostate, no more.
So that was
no
an
more.
experience we have. There are many times where the patient come to us and we detected something else. So we already planned the cells at that time, So we took away some of the cells, which stimulate the enlargement of the prostate, or we stimulate the growth of the cancer. So for that reason, sometimes you prepare the concoction, you may have to do some variation. At the same time, we give the extra timers to super boost the immune system. Okay? So that was what is happening now. All the time. We also have to super boost the immune system because it's going down after 65. Okay? There's only two reasons why men have to die. The depletion of the stem cells and the depletions of the T cells, the immune cells. So without the T cells, you are prone to infection. Okay, and cancer cells become very strong. Okay. Any other questions? Yes. How long did you feel the effect? Is it?
Over 2 weeks. Yeah.
I told Tan Sri 3 months. I normally tell everyone 3 months, but it depends on the individual, you see. So it's good to be more conservative because within the 3 months we know we are confident that there will be results, you see. I say within the 3 months, but through our experience, some younger children, it can be within the day, within the week, we don't know. Because the reception is better for a younger kid, And this is with our experience with Down syndrome or cerebral palsy or Parkinson.
My chuchu also
autistic.
having this,
Yes.
this
Yeah.
not a Parkinson, this
Yes, his grandson, he's 7 years old, he's an autistic child,
yeah, yeah.
a bright as you
He
heard
came
the
back
story.
here, he's a lot now in the house. No more melting down.
Uh-huh. Okay. And his response was good because after the treatment, I was told the next day they react differently, as you heard in the what the grandma said yesterday.
He can express himself, makan, all these things. Without that, you were just shouting every day. He got frustrated, always frustrated. So we came here, get it, and then he's now okay in the house. Even in school, the teachers are very praising him.
So Tan Sri actually paid the money and brought his grandson. They paid the money too for that when they first came to do all these treatments. Okay. So on our side, we have to ensure we can treat the patient, and we have to have some way of analyzing it that they will deliver some results. Otherwise, the patient will be suffering, paying you the money without the results, you know. So we have to deliver. And to deliver, we have to analyze the condition of the patient very carefully. And that is how our medical team across the world. And the good part is, with our experience of 40 over years, with a few hundred over doctors under our payroll, it is a strong kind of a community where we can discuss among ourselves. So we also are moving a lot into other form of brain damage, and of course and one of them would be sport injury. Again, it may involve the brain and not only the limbs or other parts of the body. Okay. Any other questions? So thank you so much, Tan Sri.
Thank you, thank you.
Thank you for making all the way. He has his treatment yesterday, and yet he drove down today here. You know, when I asked Puan Sri how is Tan Sri, you know, and maybe the doctors here would like to hear his story, because you heard him. You heard the why, but today you see him in person. Okay, and maybe some of you saw him in person yesterday before he had the therapy. All right, yeah. Thank you so much, Tan Sri. Thank you so much. Okay.
Nice to be here.
Yes. Thank you. Thank you. Yes. Okay, Tan Sri.